Okay, so we're going to focus on hyaluronic acid fillers, which are your temporary fillers. These are all different types of filler. So basically, we have different types of hyaluronic acid gels that might be more ideal in certain areas. For example, Kiss is ideal for the lips, but guess what? We can use it other places than just the lips. Refine is used for refining the fine lines. But at the end of the day, all the gels are actually very similar because they're hydrogels, which means they're a water-based gel, which actually means most of the gel is water. In fact, it's 99% water. The remaining balance is your hyaluronic acid that gets cross-linked into a gel. This is some Restylane silk here. I'm gonna open that up. So this is a syringe, because sometimes I think people don't realize what a syringe actually is, meaning the size is. So this is pretty tiny. This is 1 ml, 1 cc, so this syringe here, and that's filled with 1 milliliter of gel. If we take 5 of these syringes, 5 of them will fill 1 teaspoon. So 1 teaspoon is equal to 5 of these. I'm gonna just actually squirt this out on the back of my hand. You can see, so that's half of the syringe. It's very smooth and soft and cool to the touch. So that is Restylane silk right here. This is actually the smoothest and finest of all HAs, hence it's called silk. But at the end of the day, when we're injecting these gels, it's really about getting enough volume to our target. So whether it's a fold or a depression, most of what I'm doing day to day is softening shadows in the face. So when we're using a gel to plump up the tissue, to restore volume that's been lost, it's to soften shadows. Because when you look at a youthful face, there's not a lot of shadows in the face. So we can also use this to add volume around the mouth. We can add volume around the eyes, pretty much anywhere. But most of the areas that I focus with hyaluronic acid gels are more for details. There's minimal downtime, meaning there might be a little bit of post-treatment swelling after injecting the hydrogel. So hyaluronic acid gels don't cause a lot of swelling, but there can be some swelling post-treatment. So most of my patients, they could actually go for dinner that same night. But if you do have some exaggerated swelling, that resolves within about 48 hours. The worst of swelling is always better after 48 hours. I've been injecting for 20 years, so I know how things progress, what looks normal and what's abnormal. And 48 hours is kind of the sweet spot. So if you're planning before a special event, ideally at least 48 hours, and my preference is actually before a special event, 2 weeks to plan ahead. There's multiple products that can be used. We're always going to pick the product that's going to work best for you, and that's from our professional experience. Hopefully this has helped you a little bit as far as hyaluronic acid gels, your temporary fillers that end up lasting about a year. Cheers.